Hey, this is Carl B, and you're on the healthcodeacademy.com YouTube video page, or maybe you're on my webpage and you're watching the video through it. Either way, we're going to talk about blood clots today because, as you can see here, I got some sweet bracelets, and no, I wasn't at like an awesome concert, wasn't crowd surfing or having fun. I was actually in the hospital. Really quickly, I flew back to Los Angeles on the 30th of December 2014, and then like Saturday, Sunday, it got a little bit worse to the point where I was a little bit concerned. I knew about blood clots. Talked to my doctor on Monday. His receptionist went in, and he was like, you're pretty. He calls me bro. He's like a really cool guy. He's like, yo, bro, you're good. But we're gonna give you an ultrasound tomorrow. It's the earliest you can be seen. Since it was later in the day. And he's like, you'll probably be fine, but just to be safe. So I go get my ultrasound, and I remember the technician was like, yeah, you can't leave, we have to talk to your doctor. So I knew something was up. Went to see my doctor. He's literally across the street from where I had the test done, and he said, you have to go to the ER. Of course, he had already told me. Blood clot in my leg. So basically what happened, I flew back from Pennsylvania, Los Angeles, and I got a blood clot. There are different forms of blood clots. Some people can get them in, the veins that are closer to the surface of the skin, which is typically not as serious as DVT, which is what I had and a lot of people have. More serious DVT is deep vein thrombosis. And especially if you're, you genetically you have varicose veins, bad valves, you are at an increased risk for this, because there are a lot of things I didn't do that could have prevented this blood clot. Really quickly, I'll go through them. What I should have done: every half an hour to an hour, I should have gotten up out of my seat. I had an aisle seat. Having an aisle seat is definitely good if you're concerned about a blood clot, so you can at least stretch one leg. Or better yet, first class or an emergency exit if possible, because you have more leg room, of course, in both. So I should have gotten up, walked around, walked up and down the length of the plane a couple times every half an hour to an hour. Also, what I'll be doing, I'll have a big bottle of water, and it'll be empty because TSA, you know how they are, you can't have liquids. So I'll just bring my empty bottle to the airport, fill it up after I get through security, water, fountain water, and I will drink that and stay hydrated. Next, compression stockings, very important. My brother is a microsurgeon, always wears compression stockings because he's staining all the time, and of the 7 people in my family, he's the only one who hasn't had a blood clot. So definitely wear them. If you're really high risk, you probably know to wear them, and you'll probably always be wearing them. You can go to the doctor, they'll fit you, they'll get you a pair. They're just really tight stockings, and they keep your blood flow going well, especially if you have varicose veins, genetically bad legs, valves, veins, arteries, the good stuff. And now you can get stylish looking compression stockings for women. You can wear the stockings with like a skirt and look good. For us guys, we just wear them underneath our pants. Not a problem, it's all good. What else should I have done? I should have taken a baby aspirin. Some people will say a regular aspirin. Talk to your doctor about which is better. Should have done that, but I didn't. And what else should I have done? I have all these notes here, notes and notes. What am I missing? Oh yeah, now that I've had this, since I've had a blood clot, instead of doing a baby aspirin, I would do Lovenox, which is the fastest acting, maybe with the exception of Heparin, fastest acting blood thinner. So I know a girl that does this. I'm going to talk to my doctor about it, so when I fly, when I'm not on a blood thinner, hopefully. Basically, Lovenox, you get a shot around, a couple inches east or west of your belly, and it's a blood thinner, works really quickly. So this girl told me that she gives the shot to herself before flying. It's a blood thinner, her risk of getting the blood clot is lowered dramatically, so definitely something to look at. So now let's get into everything. I just have so much information. Let's go into prevention really quickly, and then we'll get into the more in-depth stuff. I have it right here. Prevention, I talked about this in the other video, I'll go really quick. Exercise, especially walking 30 minutes a day. very healthy for your cardiovascular system, just to get a little bit of exercise. It's good to do, so try to do it, talk to your doctor. Maintain your proper height-weight ratio. You're at a higher risk if you're obese or overweight. I am neither, and I still got a blood clot, so but try to be height-weight proportionate. Next, don't smoke. Of course, smoking just messes with your cardiovascular system. I think it hardens your veins and arteries as well. So if you smoke, try to quit. There's programs for you. It's not easy, I know, but I have friends that have smoked in the past, but many of them have quit, so look into that. Avoid sitting in bed, not moving your legs if you're reading a book or something like that. And, if you're on an airplane, obviously, like I said, get up, walk around, stretch your legs, move around, especially if you're a tall dude like me, 6'4". All right, next, let's go into the good stuff. I have my notes behind me here. We're going to go into everything really quickly. What puts you at a higher risk? If you've had a blood clot, I'm sure you'll recognize most, if not all, of these. First off, genetics. I'm half Italian. A lot of Italians have varicose veins, just bad veins. About 8 years ago, I had varicose veins, they hurt. I ended up getting surgery on the back of my knee, the same knee that got the blood clot. They took out some vein, they soldered it shut, and they actually found a blown valve, which they didn't know about until they went in, took that out. So, if you have varicose veins, some people call them spider veins, they're kind of popped out, they don't look good. Sucks having them, but you're definitely at an increased risk because your blood is pooling to some degree, P-O-O-L-I-N-G, not P-U-L-L-I-N-G, and when that happens, you're at an increased risk for a blood clot, especially if you're on an airplane or not moving. All right, next, I mentioned, cramped spaces, airplane, anything where you don't have a lot of room. Also, I mentioned sitting, standing as well. If you're, I have a brother that's a microsurgeon. He wears compression stockings because he's always standing up. Let's say you're in a profession where you do a lot of standing. Maybe you are a beautician or you cut hair or something like that. Especially if you have varicose veins, talk to your doctor about compression stockings, I should say, and whatever else they recommend you do. Next, if you're on hormones or steroids, and birth control is a hormone, and a lot of women who take birth control are at an increased risk. So talk to your doctor if you're concerned about that, ladies. And next, pregnancy. My sister actually got a blood clot when she was pregnant. You're just at a higher risk. Part of it's hormonal, part of it's, you're a little bit of, I don't want to use the word bloated, but you're pregnant, you have more weight on your legs, your ankles get swollen, and that's increased risk. Next up, surgery. If you have a surgery, increased risk possibly, if you have, especially a hip replacement, increased risk for a blood clot, so be mindful of that, kind of correspond with your doctor to make sure you don't have any problems afterwards. Trauma. Let's say you play a sport, you play football, you could get a blood clot, trauma of any part, you get in a car accident. So be mindful of that. You have pain afterwards, talk to the doctor just to make sure it's not a blood clot. And of course, if you're older or you are overweight or obese, those are definitely triggers for a blood clot, higher risk, so just be mindful of that. Okay, symptoms. What happened to me was, like I said, it took maybe 3 days or so, woke up sore. My house was really cold, so I was like all curled up. In my blankets, I thought I just slept wrong, but it got worse, so that was the symptom that I had. It's like a soreness, like a throbbing pain. I had it in my leg. Of course, you can get blood clots, in your arm, so I'm not quite sure what that would feel like, but they do say the symptoms are similar as far as these go. You could have swelling, which I didn't have in my leg. I caught it pretty early, thank goodness. But if you have swelling and heat radiating from that area or redness, could be a blood clot, so definitely talk to your doctor about it. And with the swelling and the heat, usually they say it's hot to the touch or warm to the touch. It might be easier if you have somebody else kind of do, it's hard to figure it out yourself. I should add that what makes it so important to talk to your doctor if you have these symptoms is you could have an embolism, and that can be fatal, and that's when your blood clot, either all of it or a part of it, breaks off and it goes to your lungs or your heart or to your brain, and that can cause a stroke. And here are the symptoms of the embolism. Okay, if you have any of these, call 911. Shortness of breath, coughing, coughing up blood or blood-tinged phlegm, chest pain, rapid heartbeat, and those, like I said, call 911 immediately if you're suffering from any of that, especially the chest pain. I thought I had a rapid heartbeat or like a palpitation prior to, but when they checked my lungs, I didn't have anything. So, but granted, just because that didn't happen to me, could happen to you, so or somebody that you care about. So any of those, take it seriously. Treatment. All right, the treatment. Basically, when I went in the hospital, first they put me on heparin. They hooked me up IV heparin. It's a blood thinner. It's the fastest acting as far as I know, and they gave me that. Then I had some Lovenox. They gave me Lovenox shots. They basically, you can give them to yourself if you're not a wimp like me, in your belly, basically the left or right of your belly button. They'll show you how to do it. And it hurts like hell, especially if you don't have a lot of belly fat. And so I went to my doctor because my doctor totally coordinated everything with me, and they went over and above everything. I'm very thankful for my doctor. And Lovenox, I just finished my last shot this morning. I was on it for a week or so. Finally, there's Coumadin, which is what I will be taking for probably the next few months at the very least. And that is an oral blood thinner. It's very popular. It's kind of the tried and true blood thinner that everybody knows about. It's been on the market for a long time, and basically you take that every day at the same exact time. So for me, 7:30 p.m. on the dot, my cell phone alarm goes off and I take my Coumadin pills. So basically, treatment, blood thinners, that's the main thing. Also, your blood will be drawn and they'll check your PT and your INR, basically your blood levels. The measures basically show how long it takes for a clot to form in a blood sample, and based on this I know if they need to change your blood thinner, a higher or lower dose, and I'll get into that in a moment. But of course you have to have it at the right dose so your blood isn't too thick and it's not too thin, because if it's too thin, then if you cut yourself, it's going to be very hard for it to clot. Of course, if it's too thick, you might have a blood clot. Moving on, things to consider, some very important things. As mentioned, take your dose of blood thinner, same time every day. Vitamin K. Vitamin K, things high in vitamin K they kind of combat the blood thinner. They make it so it doesn't work as well. So you're going to want to eat a consistent amount of vitamin K every day. If you have more or less, then it's going to make the power of your blood thinner too high or too low, which you don't want. So it needs to be consistent, so that when your INR is checked, when your PT is checked, they're going to have the same dose of blood thinner every day. So what is high in vitamin K? Well, there's a lot of things. I have a little list here. It's a lot of leafy greens, but I'll go through the list really quickly. Kale, spinach, Brussels sprouts, beef liver, collards, turnip greens, spinach, cauliflower, cabbage, broccoli, lettuce, and green tea, which I drink every day, but I have the same amount, so it's not a problem. Okay. There are some instructions we want to go through. Another thing, alcohol. When I read all this stuff, it says, if you drink too much alcohol, it can cause stomach bleeding. So because of that, I'm not drinking any alcohol while I'm on a blood thinner. Talk to your doctor about that if you really like your wine. Also, talk to your doctor about any vitamins or supplements that you take. and especially if you want to go off any vitamins or supplements, or you want to go on any new vitamins or supplements, definitely talk to your doctor. And of course, don't take any aspirin, which thins the blood, unless your doctor gives you the permission to do so. And also, if you go to the dentist's office, you know, most people go twice a year, or you go to the doctor's for something, any sort of procedure, you know, definitely mention you're on a blood thinner. One thing that I'm going to do is I'm going to get, you know, a little wristband that says Coumadin, like they call them medical ID bracelets. So, you know, God forbid something happens to me, I get in a car accident, you know, they'll see on my wrist, you know, you can get a medical ID card, but I'll have a bracelet. You know, they'll say, oh, this dude's on Coumadin, so we need to, you know, if I have lacerations and cuts, you know, they'll know it. The sooner they know it, the better they can treat me. So I advise that if you're on a blood thinner or any other serious medicine, to have an ID bracelet. Another thing that's very important, if you find blood in your stool, or, you know, in the toilet after you urinate, or if you throw up, definitely talk to your doctor about that, because your, you know, blood could definitely be at an unsafe level. It could be too thin, and that needs to be attended to, and your dosing might need to be changed. Another thing, 3 things to stay away from if you're on a blood thinner, talk to your doctor about it: ginseng, vitamin E, or ginkgo biloba. Also, I want to talk about pulmonary embolisms. Basically, if you have a blood clot and the entire blood clot or part of the blood clot breaks free, you know, it can go to your lungs, your brain, or your heart. And that's very, very dangerous. You know, you could have a stroke or a heart attack. So any of those 3, it's very dangerous. So that's why you need to have your blood clot attended to. You need to follow, you know, whatever your doctor tells you. Very important, because blood clots are dangerous. Pulmonary embolisms are much more dangerous. Also, I'll talk about, you know, why people have to go on Lovenox. Also, if you're pregnant and you have a blood clot, which happened to my sister, as mentioned, she couldn't take Coumadin. It's unsafe for when you're pregnant. She had to take the Lovenox shots, so she had to give them to herself. It's okay, you know, for a pregnant woman to do Lovenox, but definitely not Coumadin. I also wanted to mention how heparin bridges Coumadin. It takes about a week for Coumadin to become effective in your system. So, you know, before that, you have a blood clot, you know, you have to use other blood thinners to kind of bridge the, you know, before it can be effective. I'm referring to Coumadin. So Coumadin's the oral medication. It's great because there's no needles involved. So you have to take, you know, Lovenox and heparin, whatever else. They have so many different drugs out there, but you'll have to take that beforehand, so you'll be doing 2. And then once the Coumadin becomes effective, you know, for a lot of people, that's all we have to do is the Coumadin, and we kind of get off the others. So I'm excited to be off of the Lovenox. I'm not going to miss those shots. I also definitely want to mention, as far as storing your medicine, whether it's Lovenox or it's Coumadin, you're not going to want to store it somewhere where, you know, it gets really hot. You know, if you have a really hot kitchen or a hot bedroom, you know, you have to store your medicine out of direct sunlight, keep it away from the heat, and keep it away from excess moisture. So you probably don't want to have it in your bathroom either, because there's moisture if you're taking a hot steamy shower, and it can get hot, you know, with that hot steamy shower. So have it in a cupboard where it's a consistent temperature. Make sure, you know, you're following the directions. Read, you know, all, you know, the paperwork that comes with your prescription. Very important. And next I want to go into something that's very important. Clot busters. They're rarely used. Dissolving drugs, clot dissolving drugs. Let's say you have an embolism and you have, you know, a blood clot in your lung or lungs. They have to go in there and get rid of it because it's a serious problem. So clot busters, these are pretty much when your life is in danger. They inject it in, and it goes to work directly on the clot. And it's dangerous because it can cause bleeding, but it has to be done. One thing I definitely need to mention is some people have the misconception that blood thinners can break apart an existing blood clot, and that is not true. Blood thinners can keep an existing blood clot from getting worse, and they can prevent blood clots, but they cannot break apart an existing blood clot. The only things that can do that is A, your body can do that over time, or B, as mentioned, I mentioned clot busters, and they can break apart an existing blood clot, but of course that's only in extreme circumstances, so I definitely wanted to add that in. I also want to mention a few of the side effects of blood thinners. For me, just bruising. You'll bleed a little bit easier too. I haven't hurt myself or cut myself, but you know, when they take my blood, definitely bruising, definitely a little more bleeding than usual. That's a side effect. It's very typical, obviously. There's others, but what depends on what blood thinner you're using. So definitely check out and see what is normal, what's not normal. Also, sounds like common sense, but if you are on a blood thinner, shaving, flossing, sharp objects, 3 things you have to be careful of. You know, using scissors, be careful you don't cut yourself. Shaving, you know, whether you're a woman shaving your legs, guy shaving your neck, be very careful. And flossing, I haven't tried flossing yet. I usually do it, but I've been holding off. I'm a little nervous. Definitely be careful with all 3, see how it goes. As mentioned, when you click on the link below, healthcodeacademy.com/whatever, I haven't written the article yet, but it'll have all this information from this video as well as some additional. Also, I will have some product links for things such as compression stockings and which baby aspirin or aspirin you should use that's safe. And I'll even post a link to a safe water bottle or water container you can take on the airplane that will be large enough, you know, for all your water needs. Okay, I think that's everything. I hope that you found this to be full of information, and just realize that if you have a blood clot, it's not the end of the world. I remember being in the hospital feeling really sorry for myself and feeling bad, but there's worse things that could happen. It sucks, but if you're lucky enough to, you know, come out of it okay, then just know that, you know, there's people in the world that are suffering worse. So it'll be okay. It can be rough, but you'll get better. And even if you have to take blood thinner your entire life, it's manageable. So just, you know, follow the instructions, talk to your doctor, see a specialist. Also, if you like this video, found it informative, please like this video. Please follow healthcodeacademy.com on Facebook, Twitter. We have a mailing list. I would love it if you signed up because I talk about so many things health related. All the links are below. So I wish you awesome health. If you have any questions about anything health related, of course, especially blood clots, my experience, any advice, I'll gladly do so, offer everything I know. Just comment below. So have a great day, be healthy, and if you're at a higher risk, definitely take precautions. If you have a loved one who's at a higher risk, have them watch this video and have them take precautions, because it can happen to you. It happened to me. So it can happen to anybody just about. So have a great day, be happy, healthy. I wish you the best, and I'll talk to you soon through video. Unless you're like my mom or something, then I'll call you on the phone. All right, have a great day.